Hello students, good morning to all of you. Welcome back to this virtual class. Last period we are discussing about the infrastructure and types of infrastructure, economy infrastructure and social infrastructure, and health, which is the most important components of that social infrastructures. Energy is out of your course, so directly we will start the health, which is the most or key components, one of the key component of social infrastructure. Health is not only the absence of disease but also the ability to realize that one's potentials. You have already known in class 9, 10th about that health status as well as balanced diet, nutrients. So generally you understand that health means it is that sound physical and mental state of the individuals. Physical, mental and state of the individuals. Health is not only the absence of disease but also the ability to realize one's potentials. If you are weak, if you are suffering from fever or any kinds of disease, anybody else, he is not able to do work efficiently or effectively. So, health is a yardstick of one's well of a human being. Health is the hostile process related to overall growth and development of the nations. I have already said that infrastructure is the mirror of the state of the economy. So that is why we should give the importance, one of the most component that health, which is that part of the social infrastructures. So in the words of NSSO, health is a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. It means one person with that sound physical health or mental state, and he helps always to produce the productivity, he helps always for that social welfare, not merely the absence of disease or infirmity. It means if a person is not having any disease, it means he is not weak or infirmity, असुस्थ, इनका अंदर कोई illness नहीं है, he is that sound, but he has to effort to productivities with regard to that status of physically and mental toward that productivity or that social being. That is also most important factors. So good health composed two things. One is increase in overall efficiency to the hand of the difficult task and increase that productivity of labor due to that physical health, good physical health and good mental abilities. So it means when a person will be good physical health and mental abilities, then he can produce that productivity, his labor productivity will be increased. So overall efficiency to handle that difficulties task, he has that much potentials. So that in the words of World Health Organizations, it is that state in like this way. Health is a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity, weakness, durvalta. So it is the yardsticks of one's well-being. So important points about the health and health infrastructure. So that is why we can say that health is not only absence of disease but also ability to realize one's potential. Health is holistic process related to that overall growth and developments. Health improves the efficiency of productivity of a person, and he is able to contribute more in the economic development of a country. It is the responsible of the government to ensure that health facilities and accessibility to all the peoples. During this COVID-19 pandemic, you know very well how the government emphasizes to improve our health facilities, different kinds of production of PPT, different kinds of techniques to produce the different kinds of machines as well as medicines. So this health improves the efficiency and productivity of a person as he is able to contribute more in the economic development of a economy of a country. It is the responsibility of the governments to ensure that health facilities and which way it will be accessible to each and every person. Although it is difficult to define health status of a nation in terms of single set of measures, the health status is usually measured in terms of life expectancy of life expectancy, birth rate, death rate, mortality rate, mental different kinds of nutrition levels, along with different kinds of hospitals, medical college, PH, public health centers, or doctors. All are these included in this health status. So development of health infrastructure ensures a country of healthy manpower for production of goods and services. There has been a substantial improvement of health facilities after the independence. If we will compare when we got our freedom in the year of 1947 and this is the year of 2020, how much we have improved ourselves. Development of health infrastructures ensures how much we can improve ourselves and how much we can able to produce the different types of hospitals, doctors, nurses, paramedicals, professionals, beds, equipments, PPE required in hospital well development for the development of the peoples. Mere presence health of infrastructure is not sufficient to help that healthy people. It should be accessible to all the peoples. So health infrastructure is an important indicators to understand that health care, delivery provisions and mechanism in a country. Presently, what that health minister said that we are ready to find out the vaccine and till to that May first week. So we have the different process how that medicine of that corona medicine or that COVID-19 pandemic vaccine which should be given to that different stages to among the different peoples. So this is that one kinds of measurements which is taken by that government or mechanism process how that people will get that benefit as soon as possible, that accessibility of that medical stuffs. So if we will compare development of health status after the independence, that death rate is to be decreased, infant mortality rate is also decreased, and our life expectancy rate which is increased, that is that 67 years which was in that 16 to 18 years in the year of 1951. And also decline also mortality rate, which is also now at present that under 5, which was 248 per thousand or 245, like this it is to be decreased 5 mortality rate in the year of 2017-18. So different medical colleges we have already made dispensaries as well as community health centers, CHCS community health centers, different number of beds in hospitals, then the private hospitals and public hospitals, doctors, nurses. These are the numbers which we have already increased, but that much is less which way our population is increasing day by day. So far that primary healthcare systems, or we may say that medical college systems, dispensary systems, or CHC community healthcare systems, nurses, number of doctors, different kinds of equipments, this some extent we have already increased. But you will be surprised that during that COVID-19 pandemic, within the 12 days, DRDO is made that one hospital in Delhi. So these are that one kinds of achievements after the independence and during this pandemic. So health status after the independence, the union government evolves the broad policies and plans through the central governments of health family welfare. It collects the informations, rendered financial and technical assistance to the state governments, union territories and other bodies for implementation of important health programs in the country. Some years back, the government also introduced one program, Indradhanush program, that is that helpful for the children to become that how they will protect themselves. It is well known fact that India is the second largest populated country in the world after the China, but the state of health is that majority of the people far from the satisfactory as compared to the China as well as other developed countries. Whenever we compare with the developed countries, or you know very well, suppose you are staying in which particular areas, that areas hospital facilities or doctor facilities or the nurses facilities, either it may be the public sector or maybe the private sector, that much is not sufficient to provide that good health as per that emergency concerns. So we may say that although however the last 5 decades India has built up the health infrastructures and made considerable progress in improving the health of its populations, but this is also insufficient or insignificant as per the requirements of our people at the emergency time. So we have already expanded different kinds of health infrastructures, that is I have already said medical colleges as well as dispensaries and hospitals, community health centers, number of beds in the hospitals, doctors, nurses, all have already increased or enhanced. But this COVID-19 pandemic who gave us that how to solve during that pandemic and how we can take the necessary steps whenever we will face that any kinds of pandemics. So these are the different kinds of health infrastructures, development of health infrastructures, health status after the independence, and we have already taken that necessary steps to increase or that expansion of public health infrastructures. Thank you.